Hi friends, so with the next upcoming, let's understand the drafts that has been shared recently online by your NMC. So regarding the next step one, so this is the going to be your distribution of the items and the knowledge level of questions that would be required. The problem solving and the analytical skill types would be around 60 to 70%. The comprehension type would be around 20 to 30%. Recall type would be 5 to 15%. Right, and the competency acquisition would be must know 60%, nice to know 30%, and may know 10%. So with our current pattern of study, what we need to focus is that we need to take the complete grasp of the must know area, and at the same time make sure that our analytical skills are sharpened as we solve MCQs and study during our MBBS time. Now, moving down to the paper and the distribution of subjects. So, the step 1 is going to have your 6 subject papers with respective weightage in items and times allocation. Right, in each paper, around 10% of items will pertain to applied aspects of the related subject. So, you can see when you are going to read surgery, the applied surgical anatomy becomes a very important part. The applied aspects of all other subjects of MBBS, including FMT and community medicine, will be mainstreamed into the relevant clinical subjects. Right, so this table is providing you with the subject of each paper with respective weightage in items and time allocated. So if you see the medicine and allied subjects around 120 items and 3 hours, surgery and allied subjects that is around 120 items and 3 hours, obs and gynae would be again 120 items and 3 hours, pediatrics would be 60 items and 1.5 hours, ENT would be around 60 items and 1.5 hours, and again I would be 60 items and 1.5 hours. Now moving down to the proposed time schedule of the papers, now you can look, the medicine and allied, surgery allied and the gynae obs would be given around your 3 hours, whereas subjects like pediatrics, otorhinology and ophthalmology will be given around 1.5 hours. Now moving down to the step 2, it shall be a comprehensive practical and clinical examination to be conducted after completion of internship that evaluated competencies in clinical diagnosis, patient examination and clinical decision making, practical and communication skills necessary for practice of modern system of medicine, especially in India. Right, now the distribution of subjects for your next step 2 would be again as medicine and allied, surgery and allied, obs and gynae, pediatrics, otorhinology, ophthalmology, and they have added over here your orthopedics and physical medicine and rehabilitation. Now the time schedule for the next step 2, it would be decided by the National Medical Commission and the respective authorized universities, institutions after completion of internship and prior to the admission process of the postgraduate courses in that year. Right, and this is your tentative time schedule of the next examination and the associated events, where your next step 1 would be in your May November, or date of result by first week of June and December. Then your MBBS final part 2 practical or clinical university examination would be again in your first week of June, and the result expected by your third week of June. Internship beginning from 1st January or July, and result or the completion by your 31st December or 30th June the following year. The next step 2 regular would be your third week June or December, and the results would be expected by your fourth week. In case of supplementary, it would be your first week September or March, and results being expected by third week September or March. Now postgraduate admission would be May June, and your date of result or completion would be your 30th June, and your postgraduate courses are going to begin by 1st July or first week of January. Right, so now the NMC is planning to conduct a mock-up practice test, so it would be conducted on 28th of July. So each and every candidate should definitely give it to get a taste and an idea of what the plan is. The registration is going to begin at 28th June. Examination will be conducted by your AIIMS Delhi board. Right, only final year students. So this is specifically for the final year students pursuing MBBS courses in the medical colleges that are eligible for such mock or practice test. right? So the aim is actually to familiarize the prospective candidates with the computer-based test, software interface and process flow in the examination center. The sample questions in the mock practice will only exemplify the pattern and format of NExT Step 1. Still, they may not represent the complete examination syllabus coverage, right? So guys, now with the so much doubts over the NExT exam, I think it's almost clear that NExT is going to be implemented very soon, probably from the very next session. And with this distribution, what I would want you all to say is that do not fear this exam pattern. All we need to do is to a little modify and twist up pattern of studies by including the applied basic knowledges into a mainstream subjects, and we over here shall be helping you definitely in order to achieve that. So do not panic, just keep revising, keep reading, and now it's time for the integrated science to begin your studies with. Thank you.